Hi, my name is Dr. Ali. Welcome to Foreign MD, where we share stories and experiences of foreign trained medical graduates who were able to navigate the rigorous transition process at every level. These stories are meant to inspire and encourage you. Stay tuned. Welcome to another episode of Foreign MD. I'm excited to have you here today. I'm your host, Dr. Ali, and I have with me Dr. Eyaru. And I'm excited that he accepted my invite to come and give his story today. If you've been watching Foreign MD, you know that we've had a lot of US doctors that we've talked to. And so Dr. Eyaru is our first UK doctor that we are interviewing today. Foreign MD, what do we do here? I pretty much interview foreign medical doctors who were able to successfully transition to practice in an area that's different from where they trained. And we hear about their stories, their journey. And so I'm excited to hear Dr. Eyaru's journey today. So Dr. Eyaru, thank you. Welcome to Foreign MD. Could you briefly introduce yourself?
Yeah, thank you so much. It's been so long. Yes, really, I've been looking forward to the invitation when you invited me initially, and yeah, I'm really glad for getting this invite.
Thank you so much.
So, brief introduction of myself. I originally trained in medicine in Nigeria, University of Benin, the same class as yourself, the uni-best, as they say.
Yeah.
And after I finished from uni, spent a few years in Nigeria. And about 11 years ago, came to the UK with the pursuit of training. Got into training in general practice, and I qualified just about 4 years ago. And yeah, since then I've been here working as a general practitioner. Although I work in hospital, not in the community. So I'm actually a doctor in disguise. I'm actually an emergency medicine doctor, pretending to be a GP.
Awesome. So, tell me, so in between your journey from when you finished med school, what made you decide, like how long were you in Nigeria? Did you do any other training before deciding to come over to the UK?
That's that's an interesting question, because the answer is an interesting answer.
Okay.
Now, my decision to come to the UK had nothing to do with medical school. I actually decided to come to the UK when I was about 10.
Oh, wow.
I wasn't even in secondary school yet, and it's a very interesting story. Back then, when we still watched black and white TV,
Yeah.
I got fascinated with a program. I think it's called the Human Body, something like that. It's a program from there's this hospital in London called King's College Hospital.
Yeah.
So they talk about surgeries, essentially, how they did open heart surgery and stuff like that. And I was like really fascinated. Like, wow, I really loved it. Although it was black and white, I didn't see I didn't see all the red dot, I didn't see all the red blood. But I wasn't even in secondary school yet. I was still in primary school. And watching those programs was so fascinating for me. Many years ago, I think when I was about 3 or 4, I decided I was going to be a doctor. But now I was seeing something different, like, wow. So I decided there and then that I was going to practice medicine in the UK.
Oh, wow.
Back then. So it was a long time ago.
But it was a dream that had been formed right from time.
It's been there for a long time. And I was like, I'm going to come to the UK. I'm going to practice medicine in the UK. And I'm going to work in this hospital. So that was my motivation, really. So throughout secondary school, I just held that close to my chest. Once I got into university, the plan resurfaced again, and I went through medical school. And so it was something that drove me for many years. I think it drove me for almost 20 years.
Oh, wow.
So it had nothing to do with economics. I didn't know anything about value of money or challenges you face in practicing somewhere. It made no difference to me. I just wanted to come to the UK. So I think I started making my moves practically when I was in my 500 level.
Okay.
Started asking questions around. By the time I was in my 600 level, I had my final year of medical school. I had some idea of what I needed to do. And immediately I finished medical school, started writing my exams, wrote my first exam, I think just before I finished.
Okay.
And no, I think I wrote my first exam when I was doing my house job rotation.
Yeah.
I think it was my second or third house job rotation. I did my first exam. So that's what kicked off the process. And the following 2 years, did all the exams I needed to do. I tried to get as much information as I could, and yeah, eventually passed. And boom, got here in June of 2012.
So how many
Uh,
set of exams did you write? Did you end up writing? What's the process?
okay, so the way the UK system works, you actually start by writing an English language exam, because I think the reason why that's done is just to see your proficiency in English language. Obviously, that's the language of communication, and they had like a standardized test. So the IELTS is the first exam to be done, and you need to meet a certain criteria for you to even qualify to write the first medical exam. So that's the first one I did. Once I'd done that one, there's something called PLAB, which you actually need that to get registration with General Medical Council UK. So I did my first PLAB exam. I think this was in 2010. 2010 or 2011, I can't remember. I think it was 2010, I did my first PLAB exam. Then after PLAB, so that's like a normal, that's a written exam.
Yeah.
More of multiple choice questions. Then after doing that, I actually failed that exam, the first one.
Oh, wow.
I failed that exam by 2 marks, and I did it again. I passed. Then after that, I did the second exam, which is the what you'd call PLAB 2.
Yeah.
So passed that one in 2011 September. Then I proceeded to get like a registration, because once you have passed all the exams, you need to get registration with General Medical Council in the UK. They give you a license to practice. So that process was fairly straightforward, back and forth, documents here and there, and eventually got registered. So there's three main exams: your IELTS. Although right now they got an alternative to that, because some people had written IELTS multiple times, didn't really get the required grade. I think it's probably a harder exam, although it's just English language. The alternative exams to do just in your pursuit of registration. So the English language exam, first one, PLAB 1, then PLAB 2 is like an OSCE exam where you have stations and you have examiners, you have role players who stand in as patients, and there's a scenario. It's more like I think it's
That's
step 2 C
CS.
CS, yes. But I did step 2 CS myself.
Oh,
Yes. No, it's step 2 CS.
now,
yes, that was the journey.
so you mentioned that you had to take PLAB, the first one. Does that reflect on your overall score? Like, does it show up that you've done PLAB twice?
Oh no.
Okay.
So the way it's done is different. It's not so, like in the assembly, they look at your different steps in the exam and how you perform.
Yeah.
No, they didn't look at that. Or they don't look at that. So what they do is it's a pass or fail. There's a pass mark. So there's nothing like a weak score like you get in your step 1. So it's either you pass the exam or you don't pass the exam.
Okay.
So it doesn't reflect on your overall your registration. Now, I think one difference, or one marked difference between practice in the US and here is that when you pass your exams, you can go on straight into a non-training job.
Okay.
Unlike where you need residency in the UK, you need to like go into residency straight away for you to be able to get able to work. But here you can go into non-training jobs. And I was in a non-training job for 4 years, and I decided that you know what, let's just go into a training job, and yeah, that's how I got it.
Okay, so at that non-training job, do you get paid as like even if you decided that you didn't want to go to training, would it still be the same payment equivalent?
Yes. So the interesting thing about the UK system is that before you become a consultant, for every job in training, there's a non-training equivalent. In fact, the non-training jobs form the backbone of medical practice here, because those doctors are the ones that do like your rough jobs, more or less. The training guys, they've got specific things they're supposed to like attain in terms of competencies and stuff like that, what you get in training. Yeah. But for non-training, that doesn't obtain. So they're the ones actually doing the hard grafts, more or less. There's no obligation, there's no training obligation for them. So the system is supported a great deal by those non-training roles. So, but in terms of pay, pay is actually the same. Sometimes pay is actually higher than a training equivalent job, but there's really nothing like training in the end.
Okay. So when you decided to go into training, then what was the steps to take for that? Like, did you just apply to a
Um,
training program, or did you have to take any set of special exams again?
Training was a different scenario altogether because for training, I think after weighing all my options, I decided that family medicine or general practice would be where I wanted. A, because it was shorter, and within 3 years I would be done. Yeah. And B, I just felt that, well, the alternative was not something I wanted to do because training can really be a long process for other specialties. For instance, there's some specialties where you spend 8 years training before you even get to become a consultant.
Yeah.
Something like pediatrics, you spend like all the way from your training, your first year all the way to your 8th year. And I just felt, I'm getting too old for this. I can't. If I add 8 years to my age now, I don't think it is. so, so general practice was for me was like easy. For me, was easy way out.
Or was that your first choice? Was
But
that your initial choice?
definitely not. Now, if I take you back to the story I told you earlier, when I was a child, when I saw
Yeah.
this, cardiology operations, I think that was when I first saw something called like a heart transplant. Yeah.
Yeah.
So that the whole fire for cardiology was there. But as I grew older and wiser, I'm like, maybe not. Because despite the fact I said 8 years for training, cardiology would have been longer. And I just felt it wasn't worth the trouble. I've done non-training medical rotations, and I think one of the most difficult jobs in any UK hospital is being senior registrar in medicine. That's the hardest job in any hospital because they carry the hospital on their back, literally.
Oh, wow.
So like, there was a particular shift I did, and after that shift, I said, no more, not doing this anymore. Nope, no. So to move away from medicine, internal medicine was very easy. That I think that shift did it for me. And
Yeah.
I toyed with emergency medicine because then I switched into emergency medicine. I did emergency medicine for quite a while, still non-training. And when I looked at it, I'm like, long term. Although my consultants were like, "Oh, you seem to be good in emergency medicine. Because I had trust, I had trust among consultants. They could like leave the whole department for me to run, but I just felt this was not for me. So I think it was in eliminating the options that was where I landed in general practice. Like, yeah, quick in, quick out. 3 years, I'm done. And to me, that was what I just decided.
Okay. So looking back now, you feel like this where you are, you made the best choice for you.
Oh yes, I totally. I don't regret my choice. I think I had to make peace with the choice because sometimes I think at some point in those 4 years prior to getting trained in the UK, I wanted to. My intention was to come to the US. I'd done the steps up to CKCS,
Yeah.
but I wasn't getting interviews the way I would want, and I just felt time was of the essence.
Yeah.
I've been here for 4 years. I'm not really making any sort of headway. And so I had to make peace with the decision that okay, fine. I'm going to let the years go. But since I'm here already,
Yeah.
it's okay. So it's to me, it was a hard one, very tough one,
Yeah.
because our desires change with time.
They do.
But in the end, I was like, okay, fine. So I made peace with that decision. It took me almost 3 or 4 years to make peace with that decision. Like, okay, fine, I'm not going to chase this anymore. But
Yeah.
let's see what happens. And yeah, I don't regret it. Would I have done something differently? Likely not. But I guess it was just meant to be anyway.
That's awesome. That's awesome. So while all this was happening, what was going on the family side? Like, was it something were you able to balance the family life? I know you're married and you have 3 kids. So how did that function with your training? Was it just a breeze, or was there any struggle in that aspect?
Mm, It's a standing joke at home that the house is a running machine,
Yeah.
essentially, a running engine. Because she was very supportive, I didn't really have that challenge of family. I think the only time that pressure was there was when I was sitting my first exam, because there are 2 exams to pass to become a general practitioner. When I did my first exam, I did first exam, I didn't pass the exam. And the funny thing, the interesting thing about these things is that you fail the exam at like 2 marks. Like, so I spent the next 3 months in the dining room, the doors strictly closed. Don't come in. Let me just study for my exams. I think that's the only time, although my wife may think differently, but I think that was the only time I really had time pressure for in terms of family pressure,
Yeah.
because I just wanted to like focus on this exam and get the exam out and do it. So that was one time they didn't have as much access to me as they would have liked, and vice versa. But besides that, I don't think I really had any challenges in family, because my working patterns have somewhat been the same for many years now. So even non-training,
Yeah.
transiting into training, so it's something that we all got used to. Even now, as I'm working, I think the family has adapted.
Yeah.
I have adapted. The children have adapted, and we just adapted the work role to fit family essentially. So I would be wrong to say that it was a big challenge. It wasn't really. I didn't notice it as such.
Okay.
But that's my own personal experience.
That's awesome. So you did 4 years, and then we did the exam to be certified as a general practitioner. So your
Yes, after
training,
4 years non-training.
4 years on training,
Yeah,
then
yeah.
3 years
After 2 years,
after 3 years. Okay.
3 years of
So
training.
in the training setting, what was that like? Was it, I mean, it was kind of similar to your non-training experience, right? Because were you seeing the same things, or was it challenging for
No, it
you?
wasn't similar.
Okay.
Um, okay, in terms of training is always challenging baseline, and I think what makes training challenging is the time pressure of you now have training obligations. You have like competencies you have to meet. You have meetings with clinical supervisors and educational supervisors, and you're keeping a log of your training progress. Something we describe as the electronic portfolio, e-portfolio.
Yeah.
But I think for me that was the most challenging one for the first 2 years.
Yeah.
It's not the same patient, because my rotations went through. So the way it's structured for mine, well, 3.5 years is a year and a half is in hospital, and a year and a half is in family medicine or general practice. I chose not to go to emergency medicine as part of my rotations, because I'd already had about 4 years of this stuff. I wanted to have a more varied experience. So my hospital rotations were fine. I think the most challenging I had was pediatrics. Pediatrics has been my worst rotation of the lot. But it was different case. I think it was a good case mix, seeing different things. I think for me, the most interesting was ophthalmology, because I did a rotation on ophthalmology, and I was surprised how many eye diseases one human being could possibly get in a lifetime. So I think that was how that went for me.
Okay. So, in terms of just even moving and migrating, cultural differences from where you train in Nigeria to the UK, was it something that you were easily able to adapt and blend in, or were there any challenges?
Okay, I think the cultural difference. I think like in any new setting, you need to get acclimatized to how things happen. But I think what happened was the exams we did going towards registration to get a license, they sort of prepared us for what life would be in the UK ish. For instance, the way you relate to patients. I'll give you an example. The lingo, the way words are used in British settings is very different from what we are used to. So getting to learn what patients are, what they call different parts of their body, how you relate to them. I think for me that was very, very different. And coming to a setting where you've got patient-centered treatment or patient-centered healthcare, where you're not king, you're not directing
No, yeah,
patient.
yeah. You don't
You
give orders.
you need to seek their opinion. Yeah, so you need to partner with them to, for treatments,
Yeah.
how therapy. So adapting for me was not difficult. Within my first 6 months, I would say I probably totally adapted. Even tried to pick up this fake accent along with me so that they will understand. Because I kept getting, I got things like, my sister would say, everybody has an accent.
Yeah.
So if you listen to me, you definitely know that. I'm not native British born. I'm not a native speaker.
Yeah.
But then you speak in such a way that you do the code switching thing where at home you speak in one way, at work you speak in another way. They get you. But I think over time I've become tired of that. Just take me as I am. That's the right direction. Like I don't make as much effort as I used to. But culturally, understanding the nuances of British environment, because I'm very different culturally. I think it has taken me time to understand and adapt. But I think I have adapted well to what a typical English setting would give you in terms of relating with patients and adapting with, speaking with them. I think I've held that down properly as it stands.
That's awesome. So I'm guessing that as part of the cultural transition, you're a tea drinker now.
Oh yes, I think that was a very odd one. I tried tea. This was 2011. It was very odd when I got into, because I did like hospital rotation, like a clinical attachment in 2011. I think
Yeah.
between November, October, and December, I was in the hospital, and it was quite odd when I found out that every lunchtime everybody was offering tea, and I'm like, why is everybody offering tea? And the first time I took the tea, I didn't like tea. I never liked tea. Right
Yeah.
from Nigeria, I never liked tea.
Yeah.
And something happened that took me off tea altogether. I think my first time I took tea here, weather was different. To be honest, I've never adapted to the weather after all this time. And they gave me tea, and I noticed that I developed not a rash. I was itching all over every single time I drank tea. I was wondering, it was really bad, almost like, why am I drinking tea and everywhere I'm itching all over? So it was after a few months I found out that I had something called cholinergic urticaria,
Oh, wow.
where
Okay.
if my temperature went up even slightly from drinking
Oh,
tea,
wow.
I begin to, and there's no rash attached. It's just the itching.
This is it.
So tea was easy to give up. I was like, So I think over time that's wore off. And when I started 2 years into my training, I went into coffee, not tea.
Okay.
So I'm a coffee drinker, not a tea drinker. So I'm the tea. I just feel tea is not there, but coffee.
Copy that
I
too. That's awesome. That's
go.
awesome. It's been awesome hearing your journey. Now, tell me the things you wish you had known before you started this whole process that you think may have made it a bit easier for you. Like looking back.
Okay, looking back, I think. Okay, so like what we had talked about earlier. One problem that everyone who comes into a new setting will experience is trying to get information. Trying to get information is very it's like a big challenge because initially when we came in here, we didn't really have a lot of people guiding. There was not a lot of guidance in terms of should do this, should do
Yeah.
that, should do this, should do that. So that didn't exist. If I'd had that then, wow, my life would have been easier. I wouldn't say particular things. I would just say life in the UK in general, because over the last 11 years, I've learned by trial and error, and I've learned stuff.
Yeah.
And across the way, I learned I've learned the value of information and information sharing and how that actually makes your journey easier.
It does.
Um,
Absolutely does.
it makes a difference. So about in 2000 and I think this was 2018, someone he went to Uniben like myself. He started an organization called Nigerian Doctors in the UK, and it was more like a special thing in terms of
Yeah.
how do we like get information. And he invited me as one of the administrators of the group,
Yeah.
and I've been an administrator of the group for the last 5 years.
Oh, wow.
And interestingly, the group has grown to over 10,000 doctors,
Oh, wow.
and it has become like a one-stop shop for any information as far as living in the UK is concerned. So I think people coming to the UK now, they have it better because
Yeah.
there is nothing. When I say there's nothing, I mean there's absolutely no topic. There's no question. So it's like a platform where ask anything,
Yeah. Yeah.
ask anything, and you will always get an answer. And I'll probably say it takes up a huge chunk of my free time because on any given week, I'm probably speaking to about say 12 to 15 doctors on any given week. Phone calls, text messages, you name it. So on varied issues. Even before I came on here, 2 or 3 people had, started sending me messages. So I need to know this. I need to know this. So I think I made it my life's work to get information. Even if I don't need information, I just believe that people need information. I just put it out.
That's
But in a sense, I blog about life in the UK in general, from anything work related, family related, and life related. So I think for me, there's anything that would have made a difference for me is having a situation where I had people to guide me. I've made some really stupid blunders in my course with the time I've spent here, but they've all turned out well in the end, because then
I learned from it.
I was not just learning from it. I could learn from that and share my experience with people.
But other people,
they're not doing the same thing. So I think probably it works well.
That's awesome.
The information is the main problem that people would have, and I think right now in the UK as a community, we have that nailed down. There's no one coming here that would feel, oh, you're in darkness now. There's the information out there, you get it.
That's really great. That's really good. I'm so glad that that you all have that community support there. So anyone that's listening that wants to go, just make sure you follow that. You're on Facebook, right?
Yes, it's called Nigerian Doctors in the UK. So
Nigerian Doctors in the UK.
That's amazing.
That's awesome. That's awesome. So can you think of one tip you want to leave to any IMG that wants to transition to the UK? One tip.
Okay.
Other than joining the Nigerian doctors in the
UK. I think the one tip, not necessarily one tip, it's all about making up your mind on time if you want to. Yeah, because making up your mind on time if this is the decision you want to take. Because I notice that most people migrate because everybody else is doing it. And sometimes the problem in doing that is that you don't really get the motivation. Because it's not your original idea. You're not going to put in your best. That's one. Deciding to do it if you want to do it. Deciding where to go and getting as much information as you can before you make any sort of commitment or attempt. Because what you find is that people get half of the information or not so much. They get to a point and they become stuck because no one told them that when you get here, there's a roadblock here or there's something you need to fulfill. So I think that's getting information is key. And especially the UK, once you get in, I would tell most people, you may start with a non-training job, but now, thankfully, now I have some people that come straight with training jobs, which I don't recommend, but there are people that have thrived with that.
Yeah.
Decide to go into training as early as you can. Don't stall. The system will keep you working in non-training job forever if that's what you so desire. But decide on training as quick as possible. That's where I feel you get your best value. All the labor, all the sacrifices to come. Once you go into training and you're out of training, then you're more valuable to yourself and you're more valuable to the system. So I think that's that'll be my golden rule. Start on time, get the information.
Awesome. Well, thank you so much. I mean, you pretty much dropped a whole valuable lot of information. I'm sure there's no doctor that wants to go to the UK that would act like they are lost after listening.
No, can't be lost. How can it's been designed now. You can't be lost. Not UK.
That's awesome. That's awesome. I appreciate your time and for just valuable input. And so you can also join the conversation, the Nigerian doctors in the UK. And also I'm going to post up the interview also on Foreign MD, which is our Facebook group. And also, I guess they can reach out to you. I guess anyone, is in Nigeria, so they can always reach out to you on Facebook and ask any questions as they want to. Well, I appreciate your time, Dr. Eyaru.
Thank you so much.
And you have a wonderful rest of your day, and say hi to your lovely family and also the engine of your house.
I hope you enjoyed today's episode. Please share, like, and subscribe to encourage a fellow physician who is also on this transition journey.